Let's talk about hyperthyroidism versus hypothyroidism. We're going to look at the signs and symptoms seen in these diseases. Something to remember is the memory trick. Hyperthyroidism, think high symptoms. And for hypothyroidism, think low symptoms. These will help you remember the signs and symptoms. First is thyroid hormones. In hyperthyroidism, we have an increase in T3 and T4, but we have a decrease in thyroid stimulating hormone. So in hypothyroidism, we have the exact opposite. We have a decrease in thyroid hormone, which are T3 and T4, and an increase in thyroid stimulating hormone. Let's look at the mood. Since everything is hyper, these patients are hyper excitable, or you can think of it as they have a hyper mood. And in hypothyroidism, they have a decrease in energy. So they're gonna be fatigued and possibly show depression. All right, let's look at the temperature. In hyperthyroidism, do you think they will be hot or cold? Everything is increased, so they will have heat intolerance. And for hypothyroidism, you guessed it, they're going to have cold intolerance because their temperature is low. Okay, let's look at the skin. Patients with hyperthyroidism tend to have very sweaty skin. This is because they have a high sweat production. And for hypothyroidism, these patients tend to have really dry skin. This is because they have a low sweat production. Okay, let's look at hair now. Patients with hyperthyroidism tend to have really soft hair. This is because everything is increased and growing. As for hypothyroidism, these patients tend to have hair loss. Again, everything is decreasing. All right, let's look at appetite next. In hyperthyroidism, they have an increase in appetite. And in hypothyroidism, they have the exact opposite. They have a decreased appetite. Okay, now let's look at weight. For hyperthyroidism, you will see weight loss. You're probably thinking, wait, weight loss is not hyper, and this doesn't match with our hyper think high symptoms. But in hyperthyroidism, they have an increase in metabolism. So this is going to lead to weight loss. And in hypothyroidism, you can think weight gain. Okay, let's look at these patients' eyes. Hyperthyroidism patients tend to have something called exophthalmos. This is when the eyes appear to be bulging due to fluid accumulation behind the eyes. And for hypothyroidism, you will see myxedema. This is swelling of the skin and underlying tissue, which will be seen in the eyes, appearing as swelling eyes. Okay, let's look at GI function. Patients with hyperthyroidism have an increase in GI function, which leads to diarrhea. And patients with hypothyroidism tend to have a decrease in GI function. So you will see constipation. All right, let's look at our vital signs. We're going to look at blood pressure and heart rate. In hyperthyroidism, you guessed it, they have an increase in blood pressure and heart rate. And for hypothyroidism, they have the exact opposite, which is hypo, think low blood pressure and heart rate. That's all for hyper versus hypothyroidism. You can see how remembering hyper think high and hypo think low really helps you remember all the signs and symptoms seen in this disease. So it makes selective let apply questions a little bit easier when remembering it this way. You can find more comparisons on diseases and helpful memory tricks like this in the Complete Nursing School bundle. Happy studying, future nurses.